When it comes to reducing the pain that troubles patients the most, I think you can expect some effectiveness. The best option is stem cell therapy. The second time around, the pain tends to be stronger. I'm Dr. Wakabayashi, the rejuvenation specialist. Thank you for joining me again today. In today's video, I'd like to talk about autologous adipose-derived stem cell therapy, which is a leading non-surgical treatment for knees. This video will take a deeper look at how effective this treatment is for knee pain, especially for the common condition of osteoarthritis, so I hope you'll find it helpful. This time, I'd like to focus specifically on stem cell therapy and discuss it in more detail. Could you explain in detail what osteoarthritis of the knee is, just as some basic knowledge or information? As for this, as we get older, the knee, after all, supports the entire weight of the body, so it gradually wears down more and more because of the weight. For example, things like cartilage and the meniscus act as cushions, but as they gradually wear away, they disappear, and the bones start to rub directly against each other. That's the kind of condition we're talking about.
You often see commercials with elderly people saying their knees hurt. Could that be the condition called knee osteoarthritis?
Yeah, that's right. That's a classic example. As people get older, I think it's a condition that everyone could potentially develop. Currently, the most common treatments covered by insurance are things like hyaluronic acid injections. And if those stop working, then surgery is the next step. Usually a total knee replacement. As we mentioned in the previous video, stem cell therapy really sits right in the middle, serving as a treatment that covers the gap up to surgery. Specifically, many of the patients who choose this treatment do so because hyaluronic acid is no longer effective for them. They don't want to keep getting injections over and over, but at the same time, they don't want surgery either. I think that's a pretty common request from patients. Even when we talk about osteoarthritis of the knee, there are different levels to it. You can see this on an X-ray, and the levels range from level 1 to level 4. Level 1 is the mildest, level 2 is a bit more damaged, level 3 is where the cartilage is worn down and the bones are almost touching, and level 4 is where there's already deformation. If it's mild, that's not really a problem, but when it gets to levels 2, 3, or 4, I think that's when symptoms start to appear. You might notice things like stiffness in the morning, swelling in your knee, or pain when you move. Various symptoms like these can start to show up. Among these, stem cell treatment is recommended for levels 2, 3, and some cases of level 4. The reason your knee hurts isn't actually because there's no cartilage. Cartilage itself doesn't have any pain receptors, so it's the bone membrane under the cartilage and similar areas that have nerves. First of all, there's a tissue in the knee called the synovial membrane, which can cause pain, and when that becomes inflamed, it hurts. This is actually the biggest cause. The main advantage of stem cell treatment is that it has an extremely high ability to control inflammation. Another benefit is that there's a possibility it can regenerate cartilage. So, what does the medical data say about stem cell treatment? There was a recent study that followed people who received stem cell treatment and those who didn't for 6 months, and it showed that the treatment was quite effective in controlling pain. So when it comes to reducing pain, which is the biggest issue for patients, I think we can expect some positive effects.
So while hyaluronic acid basically acts as a cushion, stem cells have the ability to reduce inflammation. So we can expect them to be effective in relieving pain, right?
That's right. First and foremost, stopping inflammation and relieving pain is what patients want most. I think that's something that's inevitably very important. Next, it's really about the duration, right? How long will the pain be gone? That's the next question. There are various treatments like PRP and exosomes, but when it comes to stem cell treatments, you can expect the effects to last for years. We often get asked, will it be completely cured? But this really depends on the condition of the bones coming into contact with each other. It's the severity classification I mentioned earlier. For people at level 2 or 3, for example, the chances of the pain going away, or the chances of cartilage regrowing, are actually quite high. But for those at level 4, where the bone is crushed and bone spurs like little spikes have formed, for people like that, I think the situation becomes much more severe. For those cases, I personally think surgery is generally the best option. However, there are also patients who really don't want to have knee surgery. There are also people who are extremely elderly or otherwise unable to undergo surgery. For those with severe cases who are able and willing to have surgery, surgery, I do recommend it.
I see. So the treatment method can also change depending on the patient's wishes, right?
Medicine is always advancing. Unlike in the past, when doctors would just tell you, do this because I say so, that's not really how things work these days. Especially, honestly, when I look at cancer treatment nowadays, I really feel like things are different. There are all sorts of issues, like side effects being too severe or problems with hair loss and many other concerns. I think there are actually a lot of people who choose not to undergo a second round of treatment. Of course, having a variety of options is something that doctors nowadays really need to consider.
Doctor, you've treated a lot of patients suffering from knee pain up until now, haven't you?
That's right. And when it comes to non-surgical knee treatments, I've tried PRP, exosome, and stem cell treatments. But in my experience, stem cell treatment is clearly the best. The procedure for stem cell treatment starts by making a small incision near the navel. It's less than the width of your pinky finger. I think a very small incision is enough. You open it up, make a cut with a scalpel, and take out some fat. That's it, you're done.
By the way, how much fat do you actually take?
In my opinion, the more you take, the more raw material you have to work with. I think about the size of one pachinko ball is good.
Is that considered a lap?
Yeah, that's right. Cells multiply by dividing, you know? If you start with too few, the cells have to divide more times, and that means more work for each round of culturing and subculturing. If the number of divisions is too high, the quality of the resulting cells isn't as good. From the patient's perspective, taking a smaller amount seems like it would be less of a burden. And that might seem like a benefit, but your belly is where you have the most fat, right? If you make a cut here and take out a marble-sized piece of fat, do you think your stomach will get flatter? It really won't. And as for the pain when making the incision, there's no real difference since it's done under local anesthesia. The difference in the size of the scar is really minimal too.
When it comes to the amount of fat being removed, actually, the more you collect, the better the quality of the stem cells you get.
The quality improves, and it also serves as a kind of guarantee, right? For example, if you take a good amount in one session, it's possible to use it for multiple treatments. You also won't have to go through the process of collecting fat again, and if you look at it long term, it's important to collect enough from the start. I think that's really important. As for fat collection, it can be done in about 30 minutes, so you can go home the same day. I think that's a big advantage. After the fat is collected, the culturing process is actually a highly advanced and condensed technology, so you'll need to wait about 6 weeks. After that, the cells are injected into the joint. Generally, I think most clinics design the process so that it's completed in just 2 visits.
Is there any downtime or anything like that?
When it comes to stem cell injections in the knee, since the cells are being injected into the narrow joint space, you may experience some pain for about 3 days to a week. However, when it comes to tissue remodeling, like the formation of new blood vessels or seeing inflammation in the bones subside on imaging, that takes a bit more time. The number of stem cells administered in treatment also varies depending on the clinic. There's actually an interesting paper about this too. 30 million, 50 million, 100 million cells, this is per knee. They administered these amounts. Which do you think had the best treatment results?
Well, of course, isn't it the 100 million?
That's right, the group that received 100 million cells had the best treatment results. On the other hand, it seems there were also cases where they used 200 million cells. It's said that there wasn't much difference in effectiveness. So I think making sure to use 100 million cells is important when it comes to stem cell treatment. When people hear 100 million cells, they often wonder what that actually looks like. You end up with a milky white substance about the size of your pinky, not quite reaching the first or second joint. That's what gets injected. By the way, at our clinic, based on research data, we administer 100 million cells in a single dose. In terms of safety, the knee is an area with relatively low blood flow, so the safety level's really high. However, one thing we do need to be careful about is making sure there's no infection. That responsibility falls on the medical facility. And there's one more important point to mention. Sometimes, a second stem cell injection is given. The second time, the pain can be more intense. This is called an acute inflammatory reaction. So, if there are patients who receive a second dose of stem cells, I think it's important to understand that there's a more than 50% chance your knee might swell a bit or hurt as a side effect.
It's safe to say that these symptoms will definitely improve over time.
That's right. In most cases, I think things do get better, but if those symptoms last for an unusually long time, it's important to have the clinic where you got the injection take a look at it. Today, I talked about stem cell treatment for osteoarthritis. If you feel any discomfort in your knee, First, make sure to thoroughly assess the condition of your knee using X-rays or MRI. Depending on the state of your knee, regenerative medicine centered on stem cell treatment may be the best option, so please feel free to consult with us. If you found today's video helpful or interesting, please give it a like and subscribe to the channel. If you have any questions, please feel free to leave a comment in the comment section. Thank you very much for watching today as well.